Hello, Mr. Mancini. My name is Alex. I'm a level 2 nursing student here at Conestoga. So what we're going to be doing today is we're doing a wound change. But first, can I just please get some notification for you? Can I get your name and date of birth? All right, awesome. So just first, can I just, I'm just going to ask you a couple of questions about the pain. So what's making the pain worse or better right now? All right. What's the quality of the pain? And the region? Severity on a scale of 1 to 10? Is it constant or timing related? And the patient's perception along with the pain as well. So first off, Mr. Mancini, I got an order for you today, and it reads we're going to be doing a open wound change, which is cleansing with normal saline. It's going to be done twice a day, and we're just going to apply dry gauze with it afterwards. So the next procedure I'm going to do is just apply a sterile field. So I have my wound kit here. So I'm going to open it. I can touch this surface because I'm going to be just on the inside that's going to remain sterile. Use my hands, fingers on the outer layer of the wound kit. You're pulling it outwards. Now I got my sterile field. That should obviously not have fallen out. Alright, I'm going to now put on some gloves before I take off the wound dressing itself. Alright, so to take off the wound dressing, I'm just going to brace it and just slowly peel off. Mr. Mancini, this might hurt a bit. I'm going to be very careful. Just brace the skin. Make sure it doesn't pull on too hard. We'll just dispose of any tape or dressing material in the garbage or bedside paper bag as well. Alright, now Mr. Mancini, I'm just going to be grabbing this material here. And this is going to make another sterile field just by the bedside. Again, I can touch the outer 2 inches. Keep it sterile. So I'm going to be shoving this then underneath the arm. Alright, excellent. Take this out. Put the bag in here. This is just going to be my garbage bag. Now I'm going to be taking off the dressing. So we're just going to brace Mr. Mancini. This might be a little bit painful, but it'll be as easy as I can be. Put it in the garbage. Make sure not to touch, obviously, the wound at all. Note if there's any discharge or blood on the dressing itself as it comes off. Right, it seems to be dry, doesn't seem to be any blood or any residue. That's good. Make a note of that so I can document it later. And then I'll proceed to the sterilization procedure and cleaning it. Alright, so we're going to be looking at our wound assessment. We want to check if it's going to be open versus closed. So for closed procedure, it's going to be without a break in the skin, normally caused by a blunt object, or possibly internal hemorrhaging, opposed to open, which is going to incorporate a break in the skin, which is visible. Trauma with a sharp object may be involved, along with exposes to, exposes the site to infection by microorganisms. We're going to again be looking versus acute versus chronic conditions with wound healing. So that has to do with acute has to do with trauma, again with a sharp object, usually easily cleaned and repaired. Chronic has to do with different ulcers. The healing process may take 4 to 5 weeks instead of just the very fast healing, although it is seen in acute cases. Alright, so now looking at wound healing. So primary deals with the edges of the wound is very clean. It requires very minimal healing. It normally heals quickly as well, and the tissue loss is minimal in this case. Alright, so secondary wound healing deals with wounds where they're left open or allowed to heal. Scarring is normally the case with these, as well as allowing natural protection and allowing natural ability to heal. In this case, it's normally caused by a laceration or a major incision or intervention, with normally that is seen with, again, skin loss in this case. Alright, so with tertiary wound healing, normally the wound is left open to heal. Normally takes 3 to 5 days, requiring normally sutures and staples in order to heal, and scarring is minimal in this case. Alright, so some complications of wound healing include infection. So in that case, we're going to look for signs of swelling, and look for redness or anything, as well as temperature change for the client. Looking again for maybe possible signs of hemorrhaging, so blood loss, signs of hypovolemic shock, as well as dissonance, which is a separation of the wound as well that we're going to be looking for. So when we take off the dressing and everything, we want to note any drainage even before we decide to take off the dressing. So there's 4 types of things we're going to be looking for. So serous, which is kind of this clear fluid. We're looking for like purulent, which is kind of like a greenish yellowish mixture. It could be a possible sign of infection. There is serous sanguineous, if I said that right. It is a mixture of the clear serous fluid as well as sanguineous, which is more like a bright red, which indicates bleeding in this case. Alright, so now we're going to proceed on the actual wound change itself and the dressing change. So first off, I'm just going to grab my tweezers and just grab the other tweezers that I'm going to be needing later. Again, if you want to use sterile gloves, you wouldn't have to use these tweezers in this case, but since it's just very simple, simplistic wound, I'm not going to probably need the sterile gloves for this case. So to the side, what else am I going to need? I'm going to need my saline. So, this is normal saline. Yes. So I'm going to pour it right in my basin here. This spot. Awesome. Alright, then I can grab my tweezers. And I already have two 2x2s in here. If I were to open them, I'd open them on top of my tray, making sure I don't touch the actual gauze itself. So here I can grab my 2x2. One more, 2 in here. Yep. Making sure again not to touch it. Just want to dip it in my saline solution. And then just bring it out. These over here. I'm just going to see, I'm going to start cleaning your wound now. So when I clean it, I'm going to go over the wound itself once in one motion and then dispose of it. Making sure my tweezers do not touch the wound. Alright, awesome. And then dispose. And then repeat until the wound is clean. So again, grab the gauze. Submerge in my saline. And then we're good. Here again, one swift motion. Dispose. And the last one. And then rinse again. Alright, excellent. So now that I've done this, alright, so now I'm going to grab my 4x4. I'm just going to dry off the wound area. Dispose of that. And I can grab my dressing, so I'm going to be using a 4x4 gauze as operated by the order. Open it, and making sure I open it onto my sterile field. Closing it, garbage. I'm just going to make some pieces of tape up as well. Alright, so I grab my piece of tape. I'm going to be using forceps, grabbing a piece of gauze, dragging it over top. When I put this on, I want to make sure there's no creases in the tape or anything. I want to make sure the gauze is over top the entire wound to have adequate absorbent if there is any discharge. So I have my tape, brace, place it on, make sure the tape is taut, and there is minimal creasing. Mr. Mancini, good, awesome. Alright, so now that I have the proper taping and on the dressing, the wound is secure, I'm going to grab my pen. I'm just going to mark the wound with my initials on the tape, just so they know that I've done it. So AS, and the time is, order was set for 0900, so I'm going to do 0900. Alright, now that I have the wound here, just going to do initial check, going to check back later and see if there's adequate wound healing, if there's any discharge or any drainage coming from that. Took up my gloves, I'm going to dispose them for some hand hygiene. And then I'll put on another pair of gloves and then dispose of this equipment. Alright, so the ways in which you would dispose of this equipment, anything with bodily fluids whatsoever, it's going to be put into a bag of this sort. So right now we have our gauze with any of the discharge coming from the wound as we were cleaning it. That's going to be put into a biohazard bin. Along with, depending on the department you're in or the hospital, they have different methods, but I'm at Stratford currently, so a lot of the equipment gets reused in autoclaves, so it gets cleaned and then used again. So that's going to be put into that, in that kind of method, in those bins. Or if you're at another institution, they would just get put into like the garbage or another sort of area designed for that kind of equipment use. So I'm going to check periodically with Mr. Mancini to see if there's wound healing. So I'm going to check if there's proper scar formation, no signs of infection is evident either, and proper tissue growth. Once Mr. Mancini is comfortable where he's at, he's in no questions for myself, I will then proceed to document the wound dressing as well as any drainage that had occurred or any adverse findings.